Okay, we can start this this meeting with some people interested to discuss with us and to create the community of artificial intelligence in medicine. This morning we had the same meeting with around 20 people in Italy interested in the application, concrete application of software, of algorithms in medicine. And we discussed even this morning, and we discussed now, the social and ethical aspects after or during the introduction of intelligent tools, in particular the tools of artificial intelligence generative. Today, this month, is even the anniversary of the death of one of the biggest, the fathers of the computer science and informatics, Professor Alan Turing. He was a mathematician and a philosopher and even a logician. He developed the first algorithm 70 or 80 years ago during the Second World War. In that period, he formulated the famous Turing test. And now, after 70 years of his death, the new release of the ChatGPT, the release number 4, demonstrated that 56% of the people, the person who answer to this test in a short time. This test consists if some human person distinguish or not the answers given from the human person, another human person, or from the machine. This person confused and accepted in 56% of times that the answer of the intelligent system for him was true, was an answer given as given from the human person. And he confused the answer of the machine with the answer of the person. This is the Turing test. But Turing said also that we can speak of the machine is similar to human when the answer accepted is more than 70-75%. Now ChatGPT arrived to 56%. Is less of the limit posed by the Professor Turing. But maybe in the future, in some years, some months, some years, some century, I don't know, maybe in a short time or not, maybe another release or another machine. We are in front of a different machine. ChatGPT is very famous. We Google another generative AI like rank Brain and the other companies. Maybe this 75% of the correct answer for the human person, we can reach this percentage maybe in short time in the future. So the intelligent systems, the generative artificial intelligence at now, or in this period, are on the attention of the industrial field, financial field, political field, and the analysis of the religious analysis, because the impact of the artificial intelligence in different fields, even in the war, during this war between Russia and Ukraine, a lot of intelligence systems are used in order to ameliorate the weapon or the different instrument of the war, and also in order to intercept and to destroy the army or the weapon of the drone of the other competitor, in this case, the other state who they are in the war. In medicine, I think this system could be very useful if they can help, can support the decision or the evaluation, the prediction of the evolution of the disease, or indicate the best diagnosis, and in the contrary to give the best therapy in or for monitoring, for care, for rehabilitation of the patients, or to support in surgery field, or to support the rehabilitation field. For example, in an article on the Nature magazine, very important magazine, scientific magazine, a group of engineers and informaticians demonstrated that the artificial intelligence algorithm inside the exoskeleton, not only for rehabilitation, but to empower the force of the normal people, military in this case, if the system uses artificial intelligence algorithm, the exoskeleton is more precise, more powerful, more intelligent in the decision, in this case, to move some very heavy object from this robot is autonomous, and can help the people in this case in construction. For example, it's very useful, this robot, in the construction after natural disasters like alluvions or like earthquake. The wearable exoskeletons are used for people for walking, insured in motor movement, neuromotor aspect, and they can use this new system, exoskeleton, with intelligent system, intelligent algorithm. What is the intelligence, and what is the intelligence in these systems, in generative artificial intelligence? How is it different of the first generation of artificial intelligence of 50, 40 years ago? after the first program of artificial intelligence in USA, we had the second, third program in Japan or in Europe, in different countries. In that period, the intelligence was a logical deduction, and to create in a modality in well structured the rules useful for the reasoning using programming logic programming language like Lisp or like Prolog is very famous in other language. In that period, in the first period of the development of the artificial intelligence, the expert created expert systems or decision support systems in order to suggest some correct support to the man, the group, the human, but only based of the knowledge known in that period, and accepted this knowledge of the group of the interested of the experts. For example, the experts in cancer, the experts in cardiological field, the expert in geological field, the expert in a domain. They created in that period the production rules and the system, logical system, deductive systems on the base of some rules like if, then else, or using a relation and Boole logic. Every time you must upgrade this system with the new knowledge, the new rules, and update the expert system or decision super system. The problem in that period was the limitation of a programming language like Prolog and other similar systems, and the updating and of the data and the introduction of data. It's very difficult in that period to update the data coming from the clinical medical record, the laboratory, the radiological diagnostic systems. After this introduction of data and the rules, the system can arrive to conclusion with some probability, and the conclusion was a support for the human expert, for the human doctors, and they decided at the last the decision correct for go ahead. We in that period, before the diffusion of internet, we had the limitation of the computing, limitation in programming language, a limitation in the updating the rules. After the development of the statistical approach, statistical data analysis approach with the different models, Gauss model or Bayes model or other not model, explorative data analysis, classification of the data in order to separate data from similar object from the other object is not similar, using different mathematical distance of Euclid distance, distance of Mahalanobis, a different method in order to grouping similar patient with similar diagnosis with the other patient with the other diagnosis, creating cluster, different cluster of objects. And with the development of this method of data analysis, automatic data analysis, with or without model, the classification system evolved in the natural, in the artificial neural network. The neural network, after a training of the normal data, normal cases, clinical cases in medicine, after the training of 100, 200, 500, 1,000 cases, the neural network at the beginning, using a different system, backpropagation of the system of the weighting inside the hidden neurons, they classify correctly the new case after the training. The new case is classified on the basis of the training in correct ways, over 90-95%. This system is very useful because the connectionism system is very used to learn from the example. We give examples, all the examples, real examples of a real patient with the treatment and the outcome, real outcome. The new case was classified on the basis of the correct training of the good neural network, and we now have a lot of library of artificial neural network. The problem is to give more information, data to the neuron of input neuron. In order to have output neurons, only 2 or 3 or 4 yes, no, gravity or no gravity of the disease. Now the problem after the development of this software solutions, if you look in the very big statistical packages, SPSS, R, SAS, and the other big software packages, statistical software packages, they introduced in 20 years ago or less the module with the neural network. If you look in SPSS, you have now, not before, now in this century, the release with the neural network inside. SAS the same, in R package similar, and so the neural network enter very in the our work. If you read some article of doctors, they in general use some neural network and helping them, the doctors, in order to classify correct diagnosis. Another element important in this 30 years, other two important aspects are the network, the internet, and the sensors, or Internet of Things, IoT. With the Internet of Things, we have a lot of devices able to capture data directly from the environment, from the body of the patient with the wearable devices, or directly from the environment of the house, or in a company during in the part of the production. We have on the car, we have this sensor which give us a lot of information about the road, the situation. We have a lot of data coming from this Internet of Things, this object, and by internet go to the central system where this data can be analyzed very frequently in real time, changing the solution, the statistical solution, or the deduction, on the basis of this data coming very frequently in real time from the sensors, from Internet of Things, the neural network or machine learning, new system, deep learning, can give us the support, the prediction of the evolution of the situation during, for example, during the movement of the car in a road. If you give to this system, the car, or to this system for rehabilitation, for example, in exoskeleton, if we give more information from the sensors linked with the human body of the patient, for example, data from the possibility to have a functionality, function, or residual function in the movement of the hand, of the lower limb, the system, the algorithm can amplify this data and give the command to the robot. So in order following the decision of the patient to move, for example, the hand, and the robot can help this, the system can help the movement during the rehabilitation exercise, for example, for people after stroke, with the neurological stroke. In the car, it's similar. If you give to the system more information of the road, of the obstacles, and so on, with using a webcam and the other sensor, the car can follow the recommendation of the program intelligent inside the central unit, for example. So I conclude the difference between the before the first generation of artificial intelligence and the artificial intelligence in this new generation are very technological, hardware and software difference, Now we have NVIDIA, we have a system with the processing is very, 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 very high. Turing said more than 70 years ago, when we arrive 1 megabyte, Noi we are arrived in mega of megabytes, terabytes, petabytes. With the difference is in technological, electronic, different, the electronic evolution from in this 50 or 60 years. Difference in software, logic programming, and now machine learning. Machine learning is different aspect, and deductive reasoning, and now inductive and statistical reasoning, because the new system like ChatGPT or other suggest you as a result, as answer, the answer repeated, apparent, recurrent, statistical recurrent more that another answer or another word or another name or another diagnosis. This is the difference. And this it is not controlled now, because it depends on this inductive and the statistical and the enrichment of data coming from social media on the devices, medical or not medical devices. It's the difference. Maybe in the future, maybe. Now this is the situation of the artificial intelligence. In future, we can come back and integrate inductive aspect with the deductive in a loop of similar in the abductive system, similar in the medical decision. I created this hypothesis, I diagnosed the hypothesis, and I verify this hypothesis with the observation or examination, diagnostic examination, and I can change the hypothesis in a new hypothesis in this loop of deductive, inductive reasoning or abductive reasoning. But in conclusion, this very quickly updating of data coming from social media or from website or from devices, IoT, create an entropy of in the information, jungle of information. The problem, how to distinguish the true or not true, how we can distinguish the correct answer. And in medicine, this is very important question, because if you, a doctor, follow only the machine with the risk of errors in the solution. And the errors in the solution is the life of the patient, not the care. So we have a problem of ethical problem, religious problems, moral problems, philosophical problems. But we must see even the positive aspect. And another aspect is maybe we cannot stop the evolution of this intelligent system. We can rule, we can create particular rules in this aspect in order to get the wall where it's possible inside this wall, in this perimeters, we can have the possibility to control the effect of the intelligent decision taken from the machine. This is the problem. Can the machine make or take a decision without the man, without the human, or not? This is a very big problem, and the Pope, Francesco, last week, talking in the G7 conference in Italy, he posted this aspect of a positive benefit and the risk of the errors, big errors for the humanity. Najib, you for many years was director of digital health, artificial intelligence in a very big organization of healthcare, WHO. Even if WHO sometimes is not very ready, it's very powerful during the pandemic, but this is another history. What do you think? What is your idea? You are a very expert in digital health, digital
Thank you very much indeed for the talk and the in-depth analysis of what the artificial intelligence can do and cannot do. And just before this teleconference, I'm a member of the expert group in WHO actually on the governance and ethics of artificial intelligence, and a number of documents have been produced in that. So from ethical point of view, it's very, very difficult to assume that the machine will take decisions on behalf of humans, especially that it is built on the knowledge of humans. The ones and zeros are limited. Of course, when it comes to medicine and health, there is unlimited number of variables that one can control or one can think of, including the training, the education, and the social determinants of health, and the integration of human body, and many aspects. But the most important aspect, actually, that I can think of in terms of ethics and the ability of the artificial intelligence to do things on behalf of humans, number one is the bias, because it depends on the data that has been collected. So when you collect data and you build your model in Europe, it's different from Asia, it's different from the Arab countries, it's different from there. So there is bias to the geographic and the race and all that. It's, of course, it's biased against women or men or children or whatever, black and white and all that. The other thing which is actually bothering me a lot in terms of distribution of artificial intelligence is the equity problem. Equity in terms of not being able to get the artificial intelligence machine or software, and many of us actually we are using the free of charge the artificial intelligence capability. But then if you want to subscribe, then it's very expensive, and a lot of companies, they claim that they are open access and all that, they are charging a lot of money. This is one aspect of equity. The other equity problem is that many countries in the world, especially low and middle income countries, are very limited in their capacity to collect data, because collecting data requires machines that are powerful and machines that are big, and the language itself, being English, is another constraint that has to be considered. The other aspect that I can think of is the lack of the emotions in the artificial intelligence. And we know in medicine, sometimes one word can help in recovery of the person, apart from the physical injury or trauma or something like that. But the relation, the social relations between the healthcare provider and the patient is very important. And in many cases, actually, sitting with the patient and explaining the what to eat, what not to eat, what is the problem, what is not the problem. The dialogue between the healthcare provider and the patient is really important to recover. The other thing is, of course, the well-known hallucination, which means actually that the artificial intelligence can give you the wrong answer and can give you the answer that is not expected, or it hallucinates, so that whatever is going to be said, or what is actually being said, is not real or wrong. The other thing is the references in many artificial intelligence techniques or procedures or policies or whatever. The other important thing is, of course, it's very useful to use the artificial intelligence. It's very rich, it's very powerful, it's good. The only thing is that we have to find the governance structure not to allow the use of the artificial intelligence in wars and against humanity, against people. It has to be a machine. It has to be technology in favor of people, not against people, and not against those who cannot afford it, and then not against those who are poor or in less developed countries. So one can actually talk a lot about artificial intelligence and what it can do, but I strongly believe that it can influence a lot of the social setting, a lot of industries, a lot of health, a lot of medicine. We have to wait until maybe 10, 15, 20 years before it matures enough to make decisions on behalf of people. Of course, as you can say, and you have said it actually, it's very good in number crunching. It's very good in statistics. So it can calculate the number of people, the number of cases, the geography, and all that, and then it can help in the decision making. But I would not rely on artificial intelligence to make decisions on behalf of people when it comes to health, because health of the person is the most precious thing to own, and it's really not good to rely on machines to take decisions. Yes, indeed, it can help, but not to rely on it, not to use it as a replacement of humans, whether they are nurses in laboratories or doctors or clinicians or anybody who is actually taking decision regarding the medication or regarding the diagnosis or regarding anything. Yes, it can help in number crunching, in finding trends. Yes, indeed so, but not in reliable way, in a way that will completely depend on it. You mentioned robots. Yes, robots can can be very good actually in places where it's very difficult for humans to interfere, like
Yes.
climbing, like going, even doing surgery. Some of the very sort of punctual, some of the surgeries are very good actually in performing. I have seen robots actually even in countries like Argentina, where the robots actually is in the pharmacy and can take the medicine to the room of the individual because it is programmed in that way. So you go to a certain roof, or you go to a certain cupboard and pick the medicine and send it to the room number so and so and bed number so and so, which is possible. But it is the decision of the humans, of the people, to decide that is good for you, that is not good for you, and then the robots can be helpful in achieving certain results or certain things that it's very difficult, and they can actually reduce the burden on people in doing so. Can be cost effective, can be quicker, can be all the different advantages of artificial intelligence. But of course, one has to take the ethics and the governance of the development and the distribution of the artificial intelligence in healthcare and in medical institutions. The more important aspect is actually that many of our healthcare workers, whether they are nurses or doctors or physicians or clinicians, they do not know a lot about artificial intelligence, and they have to be trained about digital health and about, of course, artificial intelligence. Otherwise, they will be controlled by the salespeople. They will tell them that this is good and it's good for you, and they can sign the check for the purchase of the software or the hardware, which is not wrong, which is wrong in terms of economy, in terms of helping the patients. So these are just sort of very sort of superficial kind of impressions, but I'm happy to be part of this. And if there is a structure that you want to follow in terms of the use of artificial intelligence in medicine or in health in general, I will be more than happy to be part of that and to help in whatever way that is possible. Thank you.
Thank you to you.
Thank you.
Yes, this is the problem. Thank you for now the aspect, the psychological aspect in artificial intelligence. Is a difference between a machine and the human. This morning we discussed about the fantasy, the psychological answers of the patients during the recovery in the hospital. This is a very big difference. Maybe in future we can have answers even in this field of the psychological and fantasy aspect of difference between machine and the human persons. Maybe someone, a professor from Kaunas, he was before, he is an assistant of Professor Rikis. Maybe they in informatics, professor in computer science. Maybe someone of these our colleagues want some seminars, some workshops, or some courses, practical. And in the future, I want to organize the same. What is ChatGPT, the new release. Okay, what is the engine of reasoning? What is some example? What is the application field? In general, in administration, in lawyers, in commercial systems, or even in the school, in the education, many people use a small system of AI generative. Maybe the interest of the student and of the professor, of the researchers, is on the practical application of these instruments. For example, in lung cancer, in breast cancer, in microcalcification in the breast cancer. How this system, intelligence system, can help the doctors to classify very well the diseases. Maybe we next after the summertime, next seminars, webinar, or in presence conference must be on the real cases, application cases in the hospital, in the different discipline of the healthcare, rehabilitation, monitoring, prevention, and surgery, and so on. Today, I wrote you about this aspect of ethical aspect after the talking of the Pope in the G7 conference in Italy. But in the future, we must create a group of the people who present real application in different fields, in medicine in particular, but not only in surgery, not only in clinical specialist, but even in monitoring, rehabilitation, prevention, and health, territorial health, healthcare services for people with chronic disease, for example, in order to prevent the consequences of the chronic disease. For example, in people with diabetes, it's possible to prevent and to predict the evolution of the diabetes in diabetic retinopathy, for example. This is very important to have this signal of alert where in statistical probability this diabetes can have as consequences the diabetic retinopathy, for example. Using this system, we must present in the next webinar or courses real cases in the different aspects of the medicine. If you are agree, we can see in after summertime, in September or October, with the practical this practical presentation of how this system work, neural network, ChatGPT, RANKBrain, and I invite some professors in Italy, and not only in Italy, engineers and researchers, they use this system, doctors, medical doctors that use the system, and in which field of application this system can give good results, positive results, in order to help the care of the people with the disease, with difficulties. This is our hope, our goal, to present new system and specific application cases. This is very important. Najib, maybe we must organize the EMIT in where? In Jordan or in Tunisia?
In Jordan, you are most welcome, of course, and in Tunisia, it's nice.
It's nice.
Actually, about less than 2 weeks ago, I did participate online in a telemedicine conference in Tunisia, and
when?
That was probably 2 weeks ago.
Yeah, yes. Aziz,
Dr. Aziz
Matri, yes, wrote me about this. Yes,
and I think it's good to focus on the use of artificial intelligence in telemedicine, for example, or in health, or in cancer, or just focus the discussion on the topic rather than people talking about importance of this and that. But you are most welcome, of course. I think
yes. The problem is the situation, very, very bad situation in Palestine, in this area.
Yes, indeed.
Lebanon.
Yes.
I hope we finish very, very, very quickly, but the situation, 6 months, no, 8 months.
No, it's
October
about
till
8
now,
months.
8 months ago, or 9.
Yeah.
It's very terrible.
And
okay, thank you very much
they use
for your presence.
Artificial intelligence to kill people.
Okay, bye.
Okay.
Ciao, bye,
hello,
bye.
Sorry, I was driving. My name is Giuseppe Lanza, and thank you,
Professor Lanza.
Thank you, Professor Sicurello. Sorry, I was driving and was not able to talk properly.
Are you driving in Sicily?
Yes, of course. With very, very hot temperature, actually. And I would like to thank you for these great presentations and this concept, which are really translational and important for our clinical practice. I am a neurologist dealing with neurosonology and electrophysiology of the brain. So I think that AI could be very helpful for precision medicine in, for instance, neurodegenerative disorders to predict the evolution, for example, of a dementia or a Parkinson's disease. So the applications are really, really translational and helpful for both clinicians and researchers. So thank you very much for this contribution, and hope to see you in presence in the near future.
Maybe in Catania.
Yes, of course. Even if I...
but in this moment, I am in Agrigento. In this moment, in Catania is the volcano. Very, very... not quite.
Yeah. Also, my clinical hospital is not in Catania, is in the OASI Research Institute in Troina, which is a research institute dealing with neuroscience. So, yeah. So you are welcome in both places.
Okay, no, Troina is good. I know. Very, very nice, Professor. Ciao, Professor Giuseppe. Ci vediamo a luglio, Giuseppe. Ci vediamo a luglio. We see you in July.
Of course.
When I come back again in Sicily. Next week I go to Milano.
My pleasure.
No, because I worked for many years in the National Institute of Neurology, Besta, for many years.
Okay.
Yes, and
Yes,
I know
yes,
this field of neuro electrophysiology for epilepsy, for example.
Looking
Thank you very
forward
much, Giuseppe.
to share with you our common research interest.
Okay. Troina is okay. It's a very big, very nice, isolated but interesting center of care, rehabilitation, and research.
Yes, it's an unconventional Sicily, I would say.
Yeah, it's a similar Neuromed in Pozzilli.
Sorry?
It's a similar the Institute Neuromed in Molise region.
Yes, of course. Absolutely right. Yeah. And also is currently is a really big center for sleep medicine as well, because our scientific director is the president of the World Sleep Society. So the application of AI in sleep medicine would be also very, very promising.
Okay. Very interesting. This your suggestion. Okay.
Thank you.
We stay in contact. Ciao.
Thank you. Bye. Ciao.
Bye.
See you soon. Bye.
Bye. Take care.
Asma's Bay is here. Asma.
Hello. How are you doing?
Oh, Asma, beautiful Asma.
Thank you very much. It's a long time that you are
not meeting. You can give us some your idea, particular experience in artificial intelligence in neuroscience.
Yes, I am working now in a project with Spain, Granada, to from brains based on deep learning approaches. We did a lot of experiment to collect speech from the patients, epilepsy patients in the hospital, and we built a lot of models to restore the speech from the brain. And we hope we can collaborate with you for in a project related to neuroscience, because as you know, I am expert in machine learning and deep learning techniques.
We can extend this cooperation with the Professor Giuseppe Lanza before.
Yes,
he is very clever, involved in neurophysiology,
yes, but we're working now to restore speech from brain by a signal like invasive and non-invasive EEG brain modalities, and we can later, if you have any conference or something like that, we can present or give a presentation about our project.
Good, very nice. Thank you.
Yes.
Thank you. Make attention in Palestine.
Yeah, it's very hard now in Palestine. It's very hard condition. Yeah, it's going to be hard not to be safe nowadays. We hope we have to stay living in a safe condition.
Finish this situation. We
see. Hope that. Yeah.
Asma, next July, you want, we have this, you remember the government, the health and telemedicine conference in near Milano.
Yeah.
On July.
Yeah, I can.
I send you the program, and we can add in a virtual conference if you want, or other colleagues want to participate even in a virtual modality.
Okay, but
and you present your project.
Yes, and as I told you, I did a lot of project use deep learning and machine learning models to diagnose diseases, to also restore speech from brain, and also to use machine learning and deep learning model in breast cancer diagnosis. We can present a lot of things about AI, in particular machine learning and deep learning in medicine.
Okay, thank you very much.
Okay,
thank you, Asma.
Thank you very much.
Otherwise, we close this webinar, and we see in the next conference in presence. I don't know where, or in Italy, maybe in Sicily, in the place of the Professor Lanza in neuroscience, maybe near Catania, near the Vulcan Etna. Very, very nice places, and or in other places. In Jordan, but the situation in Jordan is not is good, but it's near the war between Israel and Israel, or in another, or in Morocco. Morocco is quiet at the moment. Okay. Best wishes to you, and best regards. Ciao a tutti. We see in the next time, or in July, in presence or in at a distance in online meeting. 10 of July. 10 of July. Bye.
Goodbye. See you.
Bye.
Bye. Thank you.
See you. Bye.
Thank you.
Thank you.
Thank you.
Bye, Professor.
Thank you very much. Goodbye.
Bye.